good day, everyone. This is Jeff Schelke, Mayor of Batavia, and I'm very honored today to be participating in a program with the Kane County Health Department about the issues that are surrounding us with the pandemic and the corona vaccine and all the other stuff that's floating around. I will tell you, very quickly here, I will soon mark my 40th year as Mayor of Batavia in the first week of May. And when I do that, I will say that this particular situation has probably been the number one thing in 40 years that I have gotten as much consternation and questions and worry and anxiety of anything that I've ever done. So I'm very appreciative this morning that the Kane County Health Department and the Kane County Board Chairman have agreed to join our Kane County Board member Dave Brown here in a panel to talk a little bit about the vaccinations in Batavia and the plans for it. And I just want to say, as the Mayor of Batavia, and as some of you know, I have several other roles in the region with the mayor's group, so I do get involved in some situations and conversations at higher levels. And I just want to share that I know right now our problem in Kane County is lack of delivery of the vaccine as far as the volume of it. And it appears from what I'm hearing in the world of Chicago where I go, is that there is some suspicion that Illinois as a state did not get its full allocation of vaccine in the initial runs. And I think that's being made up now, but that did create a deficit and it created a backup. And I think that's what the issue has been, because there's a lot of frustration out there from residents that seemingly feel like they're not being able to get the shot. And that's what we're here today to kind of take care of. So I'm going to begin this conversation with our newly elected Kane County Board Chairman, Corinne Perag. And Corinne, if you'd like to make a few comments, appreciate it. And thank you for coming.
Oh, thank you so much, Mayor, and thank you for this opportunity. And I have been in office now for 2 months, not 40 years. So I've got a lot to learn and a lot of action steps that need to be taken. I am gravely concerned about COVID-19 crisis and its impact that it's had upon Kane County. There have been recently almost 700 deaths throughout Kane County. And last March, when the first person unfortunately passed away, we saw that number starting to increase. And I think right now, I can stand to be corrected, but approximately 50,000 people have had COVID-19, the illness. The impact of that illness not only impacts our personal lives, it impacts our communities financially, it impacts our educators, it impacts our well-being, and the sense of social isolation that comes through our seniors, through our residents not being able to go out to enjoy the companionship of not only their friends, but also their families, breaks my heart. So I am making sure every day that we are going to get the vaccine out to Kane County residents as efficiently and as effectively as possible. And I feel your frustrations. I field your calls. I know the sensitivity with this. I know how anxious you are to get your children back to school. I know how anxious the seniors are to relay their fears of getting the vaccine. But I can assure you that we are going to make every effort to make this as efficient and effective as possible so that you too can go back out and hug your grandchildren and send your children back to school and enjoy that football game this upcoming fall. And the farmers market, the wonderful Batavia farmers market that takes place here during the summertime, something I dearly love. So we're working towards that end. Thank you.
Well, thank you. I just want to make, before I introduce our next panelist, I just want to make the statement that having been involved in this, obviously from the very beginning, I cannot say enough of appreciation for the job that I feel that the Kane County Health Department has done in trying to work, number one, with the dreaded disease, but also with all the consternation that's developed about the distribution, which has nothing to do with them. We're just in the line here to receive it. And they have been really subjected to a lot of questions and conversation. And they have, I think, stepped forward and has been as open and transparent as they possibly could be. And I have nothing but the utmost admiration and respect for the Kane County Health Department, and certainly for Chairman Pierogi, who has really jumped into the fire at the moment she took over office and has been hands-on with this. And we are really trying as a county to really bring this whole thing together and take care of it. So please be assured that there are people in this situation that are working diligently, almost moment by moment throughout the day, to help bring greater shots and vaccinations to our community. So with that being said, I would like to introduce one of the key persons who's been involved in the outstanding job that the health department's done, and that's Assistant Director of Community Health, Michael Isaacson. Michael?
Thank you, Mayor. So perhaps I'll start with a little bit of background about where we are here in Kane County right now with the COVID situation. So even though, as it's been mentioned, we've been struggling for almost a year now, being separated from our friends and family, seeing people that we care about sick and potentially losing their lives to this virus. But there has been some hope lately, not just in the vaccine, but as we see natural immunity starting to build up in the community as well. Right now, in the Kane-DuPage region, the state has us classified into a region. Our test positivity is down below 5%. So that means for every 100 tests that we provide to see if someone has COVID, that number is only 5%. It was 4.9 with the last data that we saw. Compared to a few weeks ago or 6 weeks ago, where we were up at 15, 16%, we've seen dramatic improvements there. So that's something that I'm extremely hopeful about. When we look at hospitalizations, over the past 45 days, the number of our residents who've been in the hospital has dramatically dropped. So that's another very positive indicator. And now, because we have vaccine, albeit much slower than we want to see it coming into our community, we do have 2 vaccines that are available. We are looking forward to a 3rd vaccine, hopefully getting emergency use authorization here in the next few weeks, so that we will have 3 vaccines that have been developed within a year's time that we are able to administer to our residents to protect them from this disease. And it's really critical to point out that even though the vaccine is not getting to us as quickly as we want, this is a highly effective set of vaccines that we have. The Pfizer and the Moderna vaccines that we're currently administering are highly effective. They are 2-dose vaccines, which requires twice as much work because every resident who wants to be fully protected needs to come to a clinic twice. And for all of our partners who are administering the vaccine, it means we need to do twice as many clinics. The new Johnson & Johnson vaccine, which hopefully is on the horizon here very shortly, is going to be a 1-dose vaccine. It is also highly effective and is going to make things much easier because it literally is going to be half as much work to get people vaccinated. So as we move forward and get more and more of our residents into clinics and get them the opportunity to get vaccinated, we're very excited as the mayor and as Madam Chair pointed out to get back to normal so that we can go to the farmers markets and really enjoy them, so we can go to concerts, so we can go to sporting events. And I think there's light at the end of the tunnel.
Thank you. And finally, we are honored to have Dave Brown, Batavia's newly elected member to the Kane County Board. And Dave, do you have any follow-up comments?
Yeah, I do, and maybe, Michael, if I could ask you before we end this, if you could maybe even put some of the numbers out there for the public as to how many vaccines the county has received and how many have been distributed and actually gone into somebody's arm. But I just thought I want to thank the mayor and Corrine, the chairman of the board, and Michael for joining us here today. I thought it was very important that we try to get the word out as best as possible as to what is really happening here in Kane County, because we've all heard the stories about how over in DuPage County or Will County or whatever, everybody's getting vaccinations and they're not having a problem. And that's just simply not true. So, I just thought it was just very important that we try to get all the information that we can to the public. I do want to thank not only Michael for all his work, and I want to put a thank you out to Jarrett Sanchez, who is the chairman of the Public Health Committee on the Kane County Board. And I want to let the public know that Jarrett is doing a great job of working with the health department and trying to give the board, all the board members, the best information that is available and all the facts so that we are all aware of what is happening with this vaccine rollout. the simple matter of the fact is kind of has been alluded to, we're just not getting enough of the vaccine, which is true with every county around us. Everybody wants more, and we're just not getting it. I can attest that the chairman of the board has been on the phone, if not daily, every other day probably, with the governor's office.
Every day.
Every day, asking why we're not getting more and trying to get more. So it's the county board and the health department, we're all doing everything we can possibly do to try to get these vaccines out there, and also to make people aware that the vaccine is safe. The county board just yesterday, I believe it was, approved a contract with a marketing department to try to get more information out through this marketing department, so that the public, again, is more aware. The health department is probably understaffed, don't have enough people to do what they need to do, and that's one of the reasons why we decided to bring on this marketing department, and I know the chairman is working on some other issues there as well. So I just want to thank the mayor for hosting this today, and Michael and the chairman of the board for joining us. And I also want to thank BATV for cooperating and putting this out there, because I do know that BATV really gets out to an awful lot of people in the Batavia and North Aurora area, as well as Geneva, and I believe even Campton Hills and wherever. It's got a really good viewing, so I thought this would be a good platform to try to get this information out. And we may be doing another one of these again in the future. I kind of hope we don't have to, but maybe we will, just to say how good everything's going.
Right.
So, Michael, would you mind throwing out some of the numbers on how many vaccines we've been able to actually get?
Absolutely, and I have to say, from the health department perspective, we're greatly appreciative of the support we're getting, and we are a small health department compared to many in the region, but we have a fantastic group of dedicated people, and I think this is one of the silver linings that we've seen through the whole pandemic, is how people have been able to come together. So when we are pushing vaccine out to the community, we're relying not only on our staff, but we have a fantastic group of volunteers through our Kane County Medical Reserve Corps. We're working closely with the nursing schools from the local colleges so that those nurses can come and assist us. We've relied heavily on the EMS system, so we have fire departments from our local communities. We've had staff from not only fire departments, but police departments and local municipalities who've played a critical role. And when you broaden out and look beyond just the vaccine, this has been something where we've worked very closely with local units of government to get information out to people, to coordinate where we can get people tested and how we can best address issues as they come up. So right now in Kane County, our real strategy is to try to get vaccine out to as many places as we can, so that hopefully we can get it administered to people somewhere close to their home so that it's convenient. So that means we're working with our 5 Kane County-based hospitals. So we have Amita Mercy Hospital in Aurora, Amita St. Joseph Hospital in Elgin, Northwestern Medicine's Delnor Hospital in Geneva, Rush Copley Medical Center in Aurora, and also Advocate Sherman Hospital in Elgin rather. Those 5 hospitals have been key in not only protecting our healthcare workers, because they've been taking care of us over the past year as people have been sick and have needed to seek that care, but now they're on the front lines helping us to make sure that we're vaccinating our residents as well. We also have strong partnerships with our federally qualified healthcare centers. So that's VNA Healthcare, Greater Elgin Family Care Center, Community Health Partnership, and Aunt Martha's. Those 4 organizations are also critical in helping us get vaccine out to the public. We're working closely with them so that we can deliver vaccine to them, and then they're working with specific subgroups within the population to make sure that we can reach everyone. Right now, as of today, Kane County has received just over 50,000 doses of vaccine. So we have 530,000 residents in Kane County. Again, we have to remember that these are, at least the vaccines we're using now, are 2-dose vaccines. So when I look at the number of adults that need to be vaccinated in Kane County and take into account that we need to give them 2 shots, that's almost 800,000 shots that we need to provide. And we've received only 50,000 doses so far. But when we get the vaccine, we push it out and we give it to people as quickly as possible. To date, as of yesterday's numbers, we had administered just under 41,000 doses of vaccine. For many people, they are now fully protected, meaning that they've had 2 doses of vaccine. Their immunity should be at peak about 2 weeks after their second dose. So we have just over 10,000 people who are fully immunized and another 30,000 people who have at least received their first shot. This week, we have clinics running all week, not only that the health department is managing, but also our partner organizations. And we're looking forward as vaccine supply continues to increase. And I'm hopeful at the national level, and again, appreciate the advocacy that we're getting from the county and our local units of government. As more vaccine comes into Kane County, we're going to be able to push it out so that more pharmacies are able to join us, so that more private doctors' offices are able to join us, so that they're able to administer the vaccine. So right now, as it comes in, it goes out, and we put it in somebody's arm as quickly as possible. Again, just over 41,000 doses have been administered, and that number is climbing every day. Our 7-day average for shots that we've administered has just gone up over 1,700 shots per day. So that's been steadily climbing over the past 2 weeks. So that's positive. But in order for us to work through our population and really get this vaccine to everybody, we're going to need to get that number over 3,000, 3,500, 4,000 shots per day so that we can get people protected as quickly as possible.
Very good. Well, I thank the panelists who have come in today, and again, I just ask your patience. I know that's very hard to ask for in a situation like this because this is a very almost desperate moment in the minds of many people. And so I can assure you with full confidence when I say this that the Kane County Health Department is out there doing every possible thing they can do as quickly as they can, and we will be pushing this along as actively and as readily as we can. And so just bear with us, and please continue to wear your mask. I learned a long time ago that when we do these, I should pull my mask down because people were telling me they couldn't understand what I said. So that's the reason I'm talking to you with my mask down on my chin. But please wear them when you're out right now, because that and following the methods of social distancing, that's another key capacity, of that whole movement. And so please bear with us and listen to what the authorities on medicine are telling us, because this is a very tenuous moment in the history of the United States of America. And we want to be able to say with great pride that when it's over and done with, Kane County was one of those that had pretty good numbers when it came to how many people got it and how many people got over it. And I think I've got a fairly decent record in that regard right now. So again, I cannot say enough for the good work of Kane County and its health department in trying to bring this thing into our lives and to work with us as quickly as they possibly can. So bear with us. We'll give you another report if things continue to lag on and we have more information. But please know that we're constantly doing this. And I think, certainly you can check with your the Walgreens and the CVS's and
Absolutely. So if people would like to go to the Kane County website, which is kanehealth.com, that's a place where we're going to continue to add opportunities where people will be able to get the vaccine. We appreciate that it's a frustrating time right now because people are going to these different sites and maybe not seeing as many appointments available. That will change, and we're hearing every day more people who are able to get vaccines at Osco, at Meijer, at Walgreens. So that's going to continue to improve. But kanehealth.com is the website where you can see where the opportunities are.
Mayor, one closing comment on my end here, I think, is, Michael, maybe you could correct me on this if I'm wrong, but quite often the county is not even aware of some of the vaccines that are coming into the area. For example, the VA gets theirs directly from the state. A lot of facilities get theirs directly from the state, and we're not even aware that they're getting it until it shows up maybe. But we were just made aware this morning that the VA facility down in North Aurora is going to be doing vaccinations on this coming Saturday. I apologize, I had that number written down and I didn't bring it with me. But I'm sure that any veteran probably is aware of what that number is. And if you call them, you can get an appointment to get your vaccine this coming Saturday in North Aurora.
Excellent, excellent. And if I may, I know that many of you have reached out to us who, for one reason or another, don't have computer access. And that is something that we welcome your calls. We are going to be working, we have that marketing company that's coming in to help us out. We're going to be giving out information on what would be an analog, old school method. So we are working with partners, Age Guide and Senior Services. We're ramping that up so that we can get the information to you. And they will help you and assist you in filling out the form so that you too can find out where you can get your appointment. I know it's very complicated. I appreciate your frustration, but we are working this out. This is a new paradigm for all of us, and this is probably the largest launch of any vaccine in the history of the United States, the history of every nation. We've not seen anything like this before. So I know you're anxious. I hear your anxiety. I feel it. It's what truly keeps me up at night. But we'll make sure that transportation is available to you as best we can to get you to the clinic and back. I know sometimes that's an issue, and we will certainly be able to ramp up that opportunity so that you'll have a trusted ally that you can call who will be able to help you fill out the form so that you can get yourself an appointment to be inoculated with the vaccine. And that I guarantee.
Well, I think that will be a wrap. We'll end this on the good words of the County Board Chairman, and I appreciate everybody that's been listening, and stay tuned. We will tell you more if need be that how we're going to do things in the future.